When it comes to pain, most guys think they should just work through it. No pain, no gain, right? Well, what if I told you that by ignoring that reoccurring pain, you could be doing more damage to your body? Whether you're an athlete or just a weekend warrior, you're not going to want to miss my next stop as we talk physical therapy with Cooley Dickinson Hospital's Rehabilitation Center in Hadley.
Cooley Dickinson Hospital's Hadley Rehabilitation Clinic is a state-of-the-art facility that has the best equipment to treat a variety of injuries and conditions. We are trained experts in the field of physical therapy, which helps people return to their activities of daily living. We get them back to doing what they want to be able to do, utilizing comprehensive treatment approaches, proper evaluation techniques, and establishing the correct diagnosis. Physical therapy is also really good at helping patients reduce their pain, manage their condition, and restore their mobility. The most common injuries that we see men coming in with are neck and lower back pain, knee and shoulder pain. Men tend to deal with their pain a lot longer. They wait as long as they can to go and see their physician. This actually can make the condition worse and delay the recovery of function and the healing process, and that's where physical therapy can come in. When you're younger, very often you heal fast, and you don't need any form of intervention. You don't really need physical therapy. But as you get older and you get into your 30s, things take a little bit longer. And that's where physical therapy can come in. We can help you return to what you want to be able to do. And we can help speed up that process of healing. It's appropriate to ask your physician for physical therapy when your pain or injury prevents you from returning to what you want to be able to do. Or after the acute stages of healing, 4 to 5 days to 2 weeks. If pain is persisting, that's when it's appropriate to ask your doctor.
In the last 5 years, there's been a lot of awareness in the media concerning sports concussions, which is fantastic. What a lot of people don't know is we can treat and help people recover from their symptoms from a concussion with physical therapy. Physical therapy has been treating traumatic brain injuries for years, helping patients get back on track after an injury. And a concussion is basically a mild traumatic brain injury. So it was a natural that physical therapy is starting to help these patients as well. I've been treating patients that have been dizzy or struggling with vertigo for about 14 years. And so then I started treating patients struggling from concussions about 6 years ago. And for the past 2 years, I've been helping run the program here at Cooley Dickinson Rehab. The most common symptoms from a concussion are headache, neck pain, dizziness, balance problems, and then an inability to return to vigorous exercise. Typically, after a concussion, a person's going to have symptoms for about 10 to 14 days. Fortunately, most of those symptoms are going to be gone during that time. But there is a small group of people that have symptoms that continue after that 2-week period. And those are the type of people that can benefit from physical therapy. A common question is, how can I prevent a concussion or prevent a second concussion? Obviously, you want to wear a helmet. Biking and skiing are the biggest sports where you really need to wear a helmet. That's your first line of defense. And there are some preliminary research out now that if you strengthen your neck, it may help prevent a concussion or reduce the intensity of a concussion. So that may help. It's not conclusive yet, but there may be more on the way.
I'm a patient at Cooley Dickinson, and I'm being treated for post-concussion syndrome. This is my 4th concussion. I was playing professional hockey overseas, and I got elbowed in the back of the head in January. And I tried coming back and playing, but I just wasn't the same. I was always a step behind and just couldn't keep up with everything, so I knew I just wasn't right. So I stopped, and when I came home, this is where I came. The treatment's been going well. I've been doing a bunch of different stuff that's related to the concussion, both vestibular and in my head, so I'm trying to figure out what's causing all the symptoms, and the staff has been great in working with me. My concentration has gotten a little bit better. When I first got the concussion, I would get sick all the time. Every time I'd lie down, I'd get the spins, and I would get sick from it, and that lasted over a month. And then progressively, it's gotten a little bit better, and since I've been working here, my ability to focus has gotten better.
What would you say to somebody who's experiencing concussion symptoms and hasn't gotten treatment?
Get treatment, because it's, it does work and it's there for a reason. And don't ignore the symptoms. There's a lot of people out there that ignored the symptoms, kept playing, didn't really think much, and later in life they're paying for it for sure. I'll stick with golf. There's no real chance. Well, I guess not for my sake, but there's no chance of getting hurt on that one. At least getting hit in the head. I'm not that bad. I'm not that bad.
If you're experiencing a reoccurring pain, talk to your physician and see if it's time that you visit Cooley Dickinson Hospital Rehabilitation Center here in Hadley and get back to the man that you used to be.